I was working, doing strenuous work, I started to get winded. That led me to have a little concern, thinking, something might be wrong here. So I went to Burke's cardiology. He said I had a valve issue. Bad at the time, but he was going to watch it every year. And he wanted to wait as long as he could because at that time the procedure was open heart surgery. And he said they had this new thing coming out where they go up through your groin, called TAVR. And he said, we'll wait till that's a little bit more perfected and the valve gets to the point where it needs replaced.
Steve Marino needs all the energy he can get as the owner of a tree farm and landscaping company. But several years ago, he began having trouble keeping his stamina up on the job.
Steve's valve was not opening properly. So as the heart would squeeze, the blood would go out to the body through a door that would not open completely. So he was being challenged by not getting adequate circulation to the rest of his body. And his heart muscle was working very hard, but just couldn't get the blood out of the heart as well as it should.
His cardiologist eventually told him it was time to consider an aortic valve replacement. The less invasive option, known as TAVR, was now available.
Lined everything up, and I had to go get a catheterization. Once we did that, to make sure everything else was fine, that's when I met Beth. She came in. She's the structural heart coordinator for St. Joe's. And she lined everything up and explained the whole procedure to me once again. And it was just smooth sailing, the whole thing. I couldn't believe, I was really assured this was going to be a 100% no problem procedure.
My job is to make this easier for them, to help them understand exactly what they're facing so that there are no surprises. And I explained what the process would be for him to have his aortic valve replaced, either surgically or transcatheter, and that as we went through his whole pre-workup, that the decisions would be made with him as to the best approach and ultimately would be his final decision. Once we had that conversation, he was able to go home and as an outpatient had a CAT scan done, pulmonary function tests, etc. And when we had all the results back, then he came as an outpatient and saw the surgeon, had another appointment with the cardiologist, and then he walked in the day of his valve procedure, was admitted overnight, and went home the following day.
I went in at 5 a.m. They did the procedure. I was in my room having lunch at 12 o'clock that day, and I was back home the next day at lunchtime, feeling great.
Steve has a very physically demanding job being in landscaping, and so he was very concerned about the impact his aortic stenosis was having on his ability to do his job, and then obviously was concerned about, after having his valve replaced, how would he be able to perform after his valve and how long it would take for him to recover.
And they told me that I had to take it easy for about maybe 2 or 3 days. That was it. And that was on a Friday, and I was back working on Tuesday. Right away, as soon as I started working, I could go further without stopping, and they said this was going to take a little time. They said it might take you about a month if you notice you're up to full steam. But I was up to full steam within the first week.
It's fantastic to see these patients realizing that, they kept blaming all of their symptoms on, I'm getting older, I'm getting heavier, this is just a way of life that I have to accept, to having their aortic valve replaced and then feeling not so short of breath and being able to walk up a hill without feeling like they needed to stop halfway or having any chest discomfort.